Very good evening to one and all. Welcome back to the today's session. Today we have our guest speaker, Dr.Premalata Rotti ma'am. So, Associate Professor and PG Guide from Department of Homeopathy Repertory and Case Taking from M.Shaikh Homeopathy Medical College and Hospital. So, today ma'am will be taking the topic Knerr Repertory, a forgotten gem and its unique two chapters. We welcome you ma'am. We welcome you all the participants. Over to you Aditi.
Hello. Yeah, good evening. It's me, Dr. Aditi Ghanasham Malkani from BHMS PG Scholar from Srimati Kebbi Award Homeopathic Medical College, Chanwad District, Nashik, Maharashtra. At the initial of the session, I would like to thanks Dr. Lavanya Sai, BHMS MD Homeopathy, PhD Scholar, National General Secretary of AIHSAYA, All India Homeopathy Student and Youth Association. Also, sweet regards to Professor Dr. Nivedita Patnaik, National Vice President AIHSAYA. Also, I would like to give my heartful thanks and regards to Team AIHSAYA Webinar Organizing Secretary, Professor Dr. Arpana Sandeep Parikh, Ma'am, Professor and HOD Department of Repertory from Srimati Kebbi Abad Homeopathic Medical College, Chanwad, Nasik, Maharashtra. Let us introduce our today's guest speaker, Dr. Premalata Rotti, Ma'am, who is going to share her insight in detail, in brief, on interesting topic Knerr Repertory, a forgotten gem and its unique chapters. So, introduction of Dr. Premalata Rotti, our today's speaker. She is Associate Professor and PG Guide in Department of Homeopathic Repertory and Case Taking in M.Shaikh Homeopathic Medical College, Belgaum. Also, she has experience since 2009 in the same College of Belgaum, A.M. Shaikh Homeopathic Medical College. She has carried out research which is leading teaching for undergraduate and postgraduate students. She has attended much of the conferences. She is mentor to the students for support and achievements of target grades. She has been supervised student project facilitating progress and encouraging deeper learning through applications, presented research findings at conferences and other public events through interactive and informative PowerPoint presentation. She has conducted individual and collaborative research projects to produce and publish articles in peer-reviewed journals. She has also served as a peer reviewer for esteemed academic journals, upholding high standards of scholarly research. She has been supervised and mentored postgraduate students, guiding thesis research and supporting academic and professional development. Numerous paper presentations conducted, to name a few. He secured third prize for Bioethicon at SRM Medical College, Chennai in 2019, organized by UNICEF. Also, she has secured the Best Paper accolade at the FSBH 2022 International Conference hosted by Sarada Krishna Homeopathic Medical College, Tamil Nadu. And she has secured first prize for the poster presentation at Alwas National Conference in 2023. Also, on 3rd March 2024, paper presentation at Dubai, second international conference, she secured consolation prize for paper presentation at 6th research conclave hosted by Bharati Vidyapith Homeopathic Medical College, Pune, and is also recognized for outstanding contribution on World Homeopathy Day in New Delhi by CCRH STSH in 2023, and at present she is BHMS MD Homeopath and PhD scholar from Parul University, Gujarat, Vadodara. In subject doc- Doctorate of Philosophy in subject of Repertory. So, I would wholeheartedly welcome our today's guest speaker, Dr. Premalata Rotti, ma'am, for initiation of the webinar on topic Knerr Repertory, a forgotten gem and its unique chapters. Over to you, ma'am. Kindly
Thank you.
start with the session.
Thank
Thank
you.
you.
Thank you so much. Good evening, all. Thank you for my brief introduction. Yeah, today we are going to discuss repertory, which is very rarely used, and why I tell it's a gem is because it has got an information which we have never seen, and which is very useful in our in day-to-day practice. Okay, so shall we start? Yeah.
Yes,
About the
ma'am.
author, Dr. Kelvin Knerr. Actually, he is a son-in-law of Dr. Herring, and his repertory is based on Herring guiding symptoms of materia medica. So, in short, we call it as Knerr's repertory by the author, but the name of the repertory is Repertory of Herring guiding symptoms of our materia medica by Dr. Kelvin Knerr. So when we see the books, okay, so we first go through the preface, wherein the author gives the insights, brief insights about the repertory, like how it is constructed, what is behind the philosophy behind it, everything. So if you go through the preface of this repertory, so we can see there that the Dr. Nair has followed the anatomical schema or the Hahnemannian schema for the arrangement of the sections of this repertory, which even Herring had followed. And also, the some of the symbols which Herring used in his Materia Medica have been incorporated in the repertory also. So, those symbols, what are they in detail? I will just show you through the repertory. And this repertory, one more unique feature is that this repertory is a concordance repertory or Puritan repertory. Puritan repertory means it follows without altering the language of the provers. The symptoms have been written as it is. So this is the preface when we see the repertory by Dr. Kelvin Knerr himself, where he explains in detail about the symbols he has used in the repertory and how the repertory is constructed. Like he has divided the pages to accommodate the space, some of the symbols and what does they mean. And he has given acknowledgement to some of the fellows who helped him to do this work, like Joseph Guernsey, Phillips, Messrs, Dowgie, etc. So this repertory incorporates around 408 remedies, and the remedy abbreviation list is given alphabetically starting from Abyss nigra to Zizia aurea. So in the beginning chapter, he gives separate yet combined. Okay, so this indicates the individualization. Though there are different parts given in the repertory, but as a whole, we need to treat the individual, not the parts. So that is exactly what he highlighted in his preface also. Though the different parts are given and the symptoms are given, but individualization needs to be prioritized. So that is why he gives separate and combined. So he dedicates this particular work in the memoriam of Constantine Herring. As I told, he is the son-in-law of Dr. Herring, and he says that the more than father, friend, advisor, teacher, in recognition of his untiring efforts to inspire the fellow men with a higher knowledge of homeopathy and a deeper reverence for the genius of Hahnemann, this book is affectionately and reverently dedicated. So he dedicates this work to Dr. Constantine Herring. As when we study any repertory, we should know where it exactly belongs. So we call it as a classification or in the era wise if we see. So this repertory actually belongs to the pre-Kentian era. Exactly, it was published just 1 year before Kent's repertory was published, and it is one of the source books for Kent repertory also. So this repertory was published in 1896, and as I told you, this repertory belongs to the Puritan group of repertory, or also called as concordance repertories, or also in the classification they are classified as repertories without any philosophy. So each word, this Puritan group, why it is said so is the purity of language of the provers or the sick people without altering. They have been given as a rubrics in this repertory. That is why these repertories are called as a Puritan group of repertories. And it has got 408 remedies, and there are 48 sections which are arranged anatomically starting from mind and disposition ending with the drug relationships. And they follow Hahnemannian schema or anatomical schema for easier reference. So when we see the plan and construction in brief, so every chapter that it is numbered as I told it, there are 48 chapters. So from 1 to 48 numbers are given, and each chapter is numbered, and the name of the chapter is given on the top, and below the title, that is below the section name, you find the rubrics which are given in the repertory. You can see, for example, one I have shown you here, inner head. So in this you find the rubrics related to the apoplexy, brain, forehead, head, headache, occiput, parietal region, temples, vertex, etc. And the rubrics, as you can see, they are given in capital and bold letters. And if you see in this repertory, one more important feature is this word rubric is repeated at every column, so that it doesn't create a confusion. Unlike in other repertories, how we see the rubric is given, either there is a hyphen or there is one space and the sub rubrics or second level sub rubrics and all they start. But here, every time we need to repeat this mentally, the rubric, and then continue with the sub rubric. So everywhere you can see there is a repetition of the rubric followed by the sub rubrics. And you can see there are some symbols used behind the remedies in every rubric and sub rubrics. So this rubric word or the heading to each paragraph is printed in somewhat bolder and blacker type, and it is followed by a colon, and it applies to each symptom in the paragraph. As I told you, it applies in full column till that rubric ends. This word rubric is repeated. So you can see here one example I have given for like as I told you, it is a Puritan group of repertory. So this is from heart and circulation section. So one rubric, heart fainting. So you can see here, puts hands to chest, cries, "Oh my heart," after a jealous quarrel, falls down. Okay, the single remedy given is lachesis here. So this is the expression of the poor or a sick person. So this is exactly why we call this as a Puritan group. Okay, so in the guiding symptom, that is in hearing guiding symptoms, it is also a Puritan materia medica. So wherein original words of the provers and clinicians are preserved to word by word without any alterations. Only when necessary, the synonyms have been added, and the same thing has been preserved in repertory also. There are certain symbols used in throughout the repertory. We exactly cannot call them as a gradings, but these symbols indicate the intensity of the symptoms. So you can see here, there are 4 symbols which are used. Okay, so these symbols are, this first one, we call it as a single thin line. Okay, so this is a single light line or thin line. It is indicates that occasionally confirmed symptoms. So you can see usually in this repertory, this one are rarely seen because they are of the lower importance. So this you rarely see, but other things you can see very frequently. The second one is double light lines. Okay, these are the remedies which are frequently confirmed, or but if once confirmed and strictly in character with the genius of the remedy. You can see here, I have just underlined few to name, or like this Ustilago you can see here, or Viburnum, Jizya. So these are the remedies which are double light lines. So which are frequently confirmed remedies for these particular symptoms. Next comes a single heavy line or a single thick line, we call it as. These are the symptoms which are verified by cures. They are of high intensity. You can see there are lot of remedies with this single thick lines or single heavy lines. You can see in this rubric Phytolacca, Plantago, Silicea, Spigelia, Staph, etc. So these are the remedies which have been proved or verified with the cure. So these have been, they have definite effects in the conditions when they have been dispensed or prescribed. The last one is the double heavy line. These are of high important, high grade remedies which are frequently verified or repeatedly verified. So this degree marks, so these 4 styles which are given, like for example, you can see here Naxomica, Lycopodium. So these are the remedies which with a double heavy line. So this, like how in other repertories we find with a different typographies. So here the intensity of the remedies are marked by these particular symbols. And these 4 symbols which the author has used, they correspond with the Bonninghausen's gradation, where he uses 5 gradations: capital, bold, italics, Roman, and Roman in parentheses. Same way, these 4 gradations, 4 symbols, they are in synonymous with the Bonninghausen's repertory. The other symbols which author has used in the repertory are theta. So this is actually, we find this theta symbol in the materia medica part, but when it comes to repertory, he doesn't give this symbol, but he gives it in the bracket. Theta meaning standing between the cured symptom and a pathological condition or a physiological general state. For example, you can see two examples I have taken here from eating chapter. Eating mental symptoms. So great anxiety every afternoon after dinner. So in the 5th month of pregnancy. So pregnancy is a physiological state and this is a pathological condition. So this remedy Sorinum. Okay, wherein, as I told you, this particular theta stands for the pathological and physiological symptoms. So this condition is a physiological condition where the person has a symptom. Here one more is there. Trachea constriction, tightening pains in left side in dry cough. So dry cough is a condition, a clinical symptom wherein the person has this particular sensation. One more here, upper part in open air in influenza. Influenza is a clinical condition again, wherein the person has a trachea constriction in and tightening pains in left side. Sorry, upper part in open air, where ipecac is a remedy. So this is how these symbols or corresponding things he gives in entire repertory. So wherein this helps us in understanding in particular physiological condition or pathological condition, if a person has this symptom, we can think of this remedy. As this repertory is a Puritan repertory, we can use it as a reference book, not for a classical repertorization like other repertories, but as a reference book, we can use this particular repertory. Next is the 3 perpendicular dotted lines. So these 3 perpendicular dotted lines, they mark the observations which have been taken from old school and which harmonize with our law of cure. So one such example I have shown you here, like paralysis, that is in the nerve chapter, paralysis mental condition with imbecility of the insane. Okay, so chloral is the remedy. So this you can see 3 perpendicular dotted lines. So these are the old school findings, but they fit in our law of similarity. The symbol used in the repertory is a T, the small t. It is nothing but it indicates that the observations have been taken from toxicological extract. Like one example you can see here, palpitation with vertigo. This is again from heart and circulation chapter. Palpitation with vertigo. You can see the T. These symbols are given always before the remedies. You should remember. You see whether this 3 perpendicular dotted line or a single heavy line, double heavy line, or this T, pi, everything. They always give before the remedy. So palpitation with vertigo, AIHSAYA is the remedy. So this is taken from the toxicological extract. That is, toxicological extract means from when this AIHSAYA is used in larger doses, material doses, so it produces palpitation with a vertigo. So from toxicological extract which fit in our law of similars, they have been indicated with the symbol T or letter small t. Next is pi symbol. So this pi we always see it in mathematics, right? 2 by 3. Pi means 2 by 3. So here pi is used in a different context. So these pi symbol indicates the symptoms which are observed on sick only. So these are the symptoms which we see only in the sick and not during the proving. So one such symptom example I have taken, eating hot things. So palate sensitive. So you can see here the pi symbol in Chimomina umbilicus remedy. So this pi symbol, can you see like this? You find these symbols throughout the repertory wherever the symptoms of the sick are listed in the as a rubric and the remedy. So you find this symbol of pi. Why we need to know these symbols is we find such symbols throughout the repertories. If we don't know the meanings, then we won't be able to use them effectively in our practice. So we should know what this symbol stands for, and when it is given attached to the remedy, whether it is a symptom, the symptom is cured or in the provers or in the sick only it is observed or from toxicological extract, we can understand. So these symbols are very important that we should be aware of. Next is a sign of a hand. This sign of a hand you can see throughout the repertories. So this sign of a hand, it is nothing but it is showing a direction. So direction for what? Direction for cross references. So this indicates a cross reference. Usually in other repertories, when we see the cross references are given in the brackets as C or as a compare, okay, or with the arrow mark, upward slanting arrow marks, etc. But here the author has used the symbol of hand. Okay, so like how we show the direction, like if any person asks, we show the direction through our fingers. So the same way the hand sign is used for cross references. Now you can see face with the deep furrows. So sunken, the cross reference is sunken. Deep furrows, we can see, compare it with the sunken, and we can see which is the most fitting rubric for our patient that we can use it. So in that way, cross references are very useful, and these cross references you can find them in the same section, different rubrics, or across the sections you can see the cross references, like from one section to other section cross references also can be seen. So this sign of a hand indicates the cross references. So this is in brief about the construction of the repertory. Already we know that there are 48 chapters in the repertory, and these chapters they are arranged according to anatomical schema. So starting with the mind and disposition, so we go as sensorium, inner head, outer head, eyes, ears, nose, upper face and lower face. So face is divided into two parts in this repertory, upper and lower face, teeth and gums, taste and tongue, okay, inner mouth, throat. We have again desire, aversions, appetite, thirst separated, and eating, drinking a separate section we find. Hiccup, belching, nausea and vomiting is a section. Scorbiculum and the stomach, that is epigastric region you can say. Then hypochondria is a section. Abdomen, stool and rectum, urinary organs, male, female sexual organs. One more important section is pregnancy, parturition, and lactation, which is given separately apart from female sexual organs. Then voice, larynx, trachea, and bronchi is there. Respiration is a section. Cough and expectoration, inner chest and lungs, heart, pulse, circulation, outer chest, neck and back, upper limbs, lower limbs, and limbs in general. Apart from upper and lower limbs, you have got limbs in general also. And there is one more section on only the modalities related to rest, position, and motion, which actually we don't see in other repertories, which are like clubbed in either generalities section or as a particular modalities. But here author gives it as a separate section itself. Then nerves is a section. Then sleep is sleep, as we find in everything. Nerve is again a new section which we don't find in older repertories. But in new repertories and all clinical repertories, we can find them. Sleep, then time is a given separate section. Temperature, weather is given separately. Fever is there.
Sorry to interrupt, ma'am.
Yes, ma'am.
Sorry. The PPT is not moving, ma'am. Actually, slides are not moving.
Just I have not included these sections in the PPTs.
Okay, ma'am. Okay.
Yeah.
Please continue, ma'am. Sorry to interrupt, ma'am.
No. Thank you so much. Okay, so then attacks and periodicity is one more section. Locality and direction is one more section. Sensation and general tissues, touch, passive motion, injuries, skin, stages of life and constitution, and regulation. These are the sections which are there, which we read theoretically in books. So because we already have them in the book, so I have not included them in the PPT. So just I read out. So these are the some chapters which we do not find in other repertories like pregnancy, parturition, lactation, heart, pulse, circulation, limbs in general, rest, position and motion, nerves, time, temperature and weather, attacks and periodicity, locality and direction, tissues, touch, passive motion, injuries, stages of life and constitution. So these are few sections to name which are there in this repertory, but we don't find them in other repertories. So these are some unique chapters which we can refer for our patients at the bedside. So to discuss some of these unique sections, so we will discuss with more important and less used chapter, that is stages of life and constitution. So this particular section, I find it very interesting because we don't find in any other repertories these rubrics. related to the stages of life and constitution. We do in case taking take about, like in preliminary data, we take the age, okay, we take the gender, we take the occupation, we take, in the personal histories, what are the habits of the individual. In the appearance and all, we write how the person appears, what is the constitution of the person, and when we finish the history, we can come to what is the temperamental diagnosis. Everything we do, but where exactly we are making use of them in prescription. To some extent, these physical constitutions, or the, what do you say, the appearances, some extent we can match with the remedies. But what about the age, okay, the gender, then other occupation, we never use them, or habits, we never use them in our prescription. So these are the rubrics, interesting rubrics, which we find them in this particular 47th chapter of Knerr Repertory, that is stages of life and constitution. So just if I go through this, see, in age, we find the boys, okay, different age group and gender wise, you can see the boys, and some rubrics are related to the boys, okay, overgrown, weak chest boys, pining, lifeless boys, like that. You find the rubrics under boys rubric, the sub rubric. Under age, next is children, okay, maybe a condition of a children or appearance of a children, you find various rubrics. And newborn, puny, rhechatic, large abdomen, anemic, which the children which grow too fast, okay, so like that you find different rubrics under children. Next is climactic period, that is menopausal age in females. So this is actually cross referred, we have only one or two remedies, and it is cross referred to female genitalia. Next comes the girls, okay, we nowadays, if you see, there are too many girls come, like they're very conscious about their appearance, etc. So like that, if you see there, what the blonde girl, the how the girl appears, or what are the complaints of the girls, like acne of the face, chlorotic girls, or headache of school girls, delayed menses, or moles or freckles, okay, romantic girls who are tall, thin, nervous, mild, impressionable, of fair complexion, tuberculous miasm. So like this, we find various rubrics under this rubric girls. Next, we find the men. You can see age-wise how the rubrics are given in the chapter. Like men, we find in life, corpulent, gouty persons, or irate temper, a man of, okay, a sedentary, accustomed to great mental exertion, studious men, okay, who with hypochondriasis, etc. So you find various rubrics. These are very few to name, because I cannot write each and every rubric. So few I have taken as an example. You can just go back to repertory and you can refer the rest of the sub rubrics. Then in old people, the age wise, the old age, okay, atrophic conditions of old people, or brain tendency to atrophy, because in old age all the degenerative processes start. So because of that, they may get the condition. So if like any findings they come, so you can use these rubrics for prescription. Deafness, again a common complaint in old age, or like in old age, the feeble digestive powers, the patients tell that पचता ही नहीं है, खाना खाता है लेकिन पचता नहीं है. So these conditions which we like you can, these rubrics can guide you to some remedies. And you, if you, in very interesting thing is, you find only one or two remedies under these rubrics and sub rubrics, so they are definitive. You can just cross check with other symptoms, and if they are matching, you can immediately prescribe. Like other repertories, you don't have a big group of remedies where you need to differentiate each and every remedy. Okay, then complaints of puberty, okay, where a girl in the girls, okay, girls of school girls, precocious, chlorosis girls, anemic girls, okay, so you find a puberty as a age. Then in women, like how we had men, old people, we have women, anemic women, delicate or maids, old maids, hypochondriacal women, obesity in women, or pot-bellied mothers. So these are few sub-rubrics to name in women rubric. Then we have one more rubric called young people. Okay, so these are all age-wise, the age differentiation, how the author has given, anemics, scrofulous, obesity, etc. Then we have rubric called youths, fast-growing youth, okay, with typhoid fever or with diarrheas, overgrown with weak chest, etc. So these are few things. Then next comes the complexion. After the age, next rubric in this section is complexion. So this complexion is not only the color of the skin, but it includes the color of the eyes and hair also. So you can see few rubrics in this particular complexion in the same section. The dark complexion, like brunette, what we call. So the brunettes who are slight and thin, etc. Or the color of the eyes, like black, gray, blue eyes, etc. Brown eyes. So the color of the iris is also given. Then the complexion, okay, the skin color, like how they appear, fair, like blonde or light colored. Women who are graceful with some clinical conditions, or florid women, freckled women, okay. Hair in that, again, different colors of hair, like black, blonde, dark, light, auburn, etc. The hair colors, okay. So which will again guide us to some remedies, because these are the observations which we take in our general physical examination in history taking. Okay, the pale, delicate, sickly looking. The pale, maybe they are delicate, because of that they are pale, or they are sickly, because of that they are pale. So this you find. Then sallow, bilious, or jaundice, the yellowish discolorations in complexion, what we see. So these are the few rubrics which are given under the complexion. Then comes constitution and diathesis. We examine and we say this person is anemic, or with the complaints we can say he's asthmatic or bilious, or cachexic means loss of weight and all, or cancerous diathesis, okay, or carbonitrogen, which is nothing but a gravel constitution, again, which corresponds with a storic constitution. So these constitutions, when we list out or we can understand, so this we can use them to refer here to confirm the remedies, whichever remedies we have got, whether that remedies belong to this particular constitution, we can use as a reference list. These again few more constitutions to name, like Dorfish short, okay, fiber, gouty, or hemorrhoidal, etc. So these are some of the constitution or diathesis related rubrics which are there in this stages of life. And yeah, so these are there. Next comes habits. As I told you, these habits we ask them and we leave it there only. We never take it forward to see like whether they are going to help us in remedy selection or no. So some habits the author has listed, like drunkards. In that again you have got some complaints in the drunkards, or the people who are dirty, okay, like by appearance or by how they are living. They are very dirty or very high living, okay, or who are drugged, subjects who are drugged, like who are into substance abuse and all, okay, and who are having this tobacco. We are right, tobacco chewing is a habit, but what next? So this we can see in this repertory. Few habits have been listed, and if we can get them, so we can use them as a reference guide. Next comes the occupation, which is the very initial part of the case taking. We ask the patients, what is your occupation? Maybe which are listed in this, maybe not suiting, but to some we can use them. Like the author has listed actors, the complaints in the actors, or even he lists the bookworms, the people who are always reading. So those people are called as bookworms. So the remedies for bookworms also are listed. Then clergymen or clerical works who are doing, or the nurses, because these are into healthcare systems and they are very much exhausted, or not only in healthcare system, but even the people who are taking care of the family, or you can say the people who are taking care of the sick in house also, who are because of the long nursing are exhausted. So for them also you have got the remedies and the sub rubrics, or the people who are not doing much of a physical work, like sedentary works, okay. Then people who are singers, because of the overuse of their voice, singers always like they are singing, so for them any complaints are there that you can refer. Or the students, so one to name is students headache. He lists only one remedy, Naxomica, students headache, okay. So usually like once in one seminar also I heard that in Kolkata, so whenever the students come with headache, they just send the doctor sends them to the this, and they give Naxomica. So this is listed in the repertory, students headache, only remedy is the Naxomica. Then teachers, okay, like teachers like us who are always like again we are using overuse of the voice, or too much mental work we are doing. So for that, any complaints that we can use. Or washerwoman, the people who are into like daily course, who are continuously working in water and all. So for them, so these few occupations are also listed, which we can use, like when we take the history. So if they fit in this, then or nearby we can use them to refer the remedies. the size of the person. Okay, dwarf means short statured or large or tall or thin. Okay, so we, like by seeing we can judge them whether they are dwarf or tall or very thin or very large. Okay, so this also we can give take it as a reference for selection of the remedies. Next comes the temperament. So temperament, different temperaments are there like bilious, choleric, mild, melancholic, nervous, phlegmatic, sanguine. So with the symptoms, we can understand which temperament this person comes under. Okay, so now we have one book also on this by Dr. Parina's ma'am, that is Temperas, and even app is there. So this all are guiding us in the selection of the remedies. So this, even in this old book, we have got remedies for these particular kind of temperaments. So this is one very interesting chapter, stages of life. Okay, wherein everybody can make use of it, and it is very very rarely used. Okay, so when I went through it, I found it very interesting. So just I thought that I can share it with you, and maybe it may help in your prescription also. Other very unique sections are like nerves. Nerve section we don't commonly find in many repertories. Okay, so this section either they are given in relation to the parts or in relation to again generalities or in sensation sections. So here the author has made a separate section on nerves, wherein he lists some of the rubrics related to the nerves, like chorea. Okay, the convulsions, wherein the activity, the electrical activities of the brain are disturbed, the fainting spells, okay, the hysterical attacks, or the lassitude or malaise, okay, nervousness, the neuralgia, that is pain or paralysis because of the nerve affections, or the restlessness of person, or the sensations, whether altered or exaggerated or like lessened. Okay, startlings, then tremblings, twitchings, weaknesses because of any nerve complaints. So these are some of the rubrics which are given under nerves. And separately, whenever like when patients come to us with any complaints and if they fit, we can use this section. Next is one more unique section I said is attacks and periodicity, which is separated and given for our reference. So now, like you see here, the rubrics which come under this are attacks, periodicity, okay, at alternating attacks. So it is in general either, like seasonal attacks or maybe increasing or intermittent attacks, or maybe they may be related to the moon phases. Okay, so most of the time we neglect this modality related to the moon phases. So attacks at moon, either new moon, full moon, or waxing or waning moon. So the person, if has this particular attack during these moon phases, so we can refer here. Or periodic, there is a certain periodicity of like certain day, fixed days, or weeks, or years. So this means the periodical recurrence of the complaints. Also attacks, how they come, whether they come suddenly or they are very gradual. So like onset, when we take in the history, we say like sudden onset or gradual in onset. So attacks, how they come each time when the person suffers, well, how he gets the attack, whether he gets suddenly or it is very gradual. So that we can refer here. Or like attacks which come yearly, that is only once in a year the person gets this, or maybe in a fixed season or fixed month the person gets this attack. So this refers to the attacks on periodicity. If a marked periodicity and attacks are there, usually we can consider this. And this periodicity, whenever it is very sharp periodicity, that it is said to be that these conditions are, they belong to the syphilitic miasm. Another section is locality and direction. Okay, so you find this main two rubrics, that is direction and locality. So in direction, we find the complaints, how they are going. Either they are going diagonal. Diagonal means like right upper, left lower, or left upper and right lower. So from one side to the opposite side, lower down. Okay, so they are called diagonal complaints. Or downward, above downwards the complaints are going. Or metastasis. Metastasis means one place the complaint is there, then the same complaint you find in other place, like how we find it in cancerous affections, where one to other organs are metastasis. So same way, even non-cancerous you find metastasis, then you can use it. Then right to left or left to right side, how the complaints travel from, because we find them in the remedies. Okay, or the complaints are moving upwards or below upwards or above downwards. So whatever the direction is there, that we need to take. Like for example, upward, like below upwards, we have like one very important remedy is conium. Okay, so like this, we have remedies wherein the directions are given in Materia Medica, but as we don't read our Materia Medica thoroughly, so we can refer the repertories to understand these finer aspects. Second one is locality. So here locality means where exactly the complaints are there. Either one-sided complaint the person is getting, left-sided or right-sided. So this locality and direction, we find it very interesting while case taking. We take it so we can have a look into it. Next comes the tissues. One more chapter which is very important. So this particular tissues we don't find in neither in modern repertories nor in old repertories. This is a very important chapter based on tissues. So we find the different tissues like adipose tissues. Okay, so in adipose tissues, we find all the rubrics related to these bones or cancer, cartilages, okay, decomposition, degeneration, emaciation, etc. Okay, so you can have the like conditions like gangrenes, okay, or fibrous conditions, or maybe glands are affected, maybe the hypertrophy of that particular part, etc., or inflammations, ligamental affections. Okay, so these are the rubrics which we find in the tissues. So again, like nerve is again one more tissue. We do, though we have a separate section on nerves, but also we have some, as a part of tissue, we have some complaints of nerves in this section also related to the nutrition or parenchymatous organs, periosteum, okay, the bony coverings or the plaque, the pyemias, connective tissue conditions. So these are the rubrics which are there in nerves. Again, we have got stenosis of the parts, okay, because of the fibrous tissues, the openings and all, they become stenosed. Okay, the suppurations, the tendon affections, okay, tumors, ulcers. So these are the few rubrics in the section tissues where we can refer it, and under this again we have got different sub rubrics and remedies, etc. Then next is, and the last chapter of this repertory is the drug relationship. In some repertories, we do have this drug relationships. They're not defined actually exactly what it is. Even we have BTPV, this last section, the seventh section is there, Concord, and then DBCR we have got. So this repertory also had got the drug relationship. In this particular section, the author has given around 415 remedies drug relationship. Okay, so again they are alphabetically given and they start from Abies canadensis to Zizia aureus. And he defines what are these drug relation means. So if you see the antidotal relation, so he defines it as these antidotes are to the effects of massive and molecular doses, chemical antidotes in poisoning, and to the lasting or chronic effects superinduced by the drug. So, wherein antidotes you can use it. Then collateral relation, author says that the side relations, that cogners belonging to the same or allied botanical family or chemical group. Means they are from the same family, so they have a collateral relations, or they're compatible, which follows one another, or the complementary, which like one will have some part and then the next part will be by the other remedies. Inimical, like drug disagreeing, incompatibles, or which do not follow well, which you should not give one after the other, like apis and rustox are inimical to each other, like that. Or similar drugs, like drugs suggested for comparison by reason of their similarity, okay, which are very compatible with each other, like nux and ignatia. So these are the relations what author has defined, and you can see them in the remedies also. So as I told, these are 415 remedies from Abyss to Zizia. Some I have listed here, like for example, natrum mur. So natrum mur has got antidotal relation with these all remedies. Okay, so phosphorus being the highest, like which antidotes. So natrum mur, after that, phosphorus should not be given. So arsenicum, camphor, etc. And then to nitrate of silver were used for cauterization. So these are the antidotal relation for natrum muriaticum. compatible to natramur. So these are the remedies groups which are very much compatible. Like, you can safely give them with a natramur. Or complementaries. After natramur, this apis is complementary. So again, this when you are giving this remedies as a relative remedies, you need to see again for the similarity, symptom similarity. If they are matching, then you can go for it. Then similar remedies, which are very similar to natramur. So these are the things. One more relation is collateral relations, like Badiaga is remedy, Spongia is a collateral remedy, and this compatible relations, complementary relations, and similar reactions. So this is how we find the relations. Like benzoic acid, if we see antidotal relations. So after abuse of copaiba in separation of gonorrhea. Okay, so these remedies can be thought of to antidote. Or the inimical relations, as I told, these remedies should not be given one after the other. Like for example, not only remedies, the author has given some even like some things which we consume. So when benzoic acid is given, the person should not consume wine because it antidotes the sorry, it is inimical, that is opposite. Benzoic acid and wine are opposite. So wine should not be consumed when benzoic acid is prescribed. Okay, the similar reaction like copaiba or ferrum, and these remedies are similar with benzoic acid. So this is all about the very important section. There are many other sections like pregnancy, parturition, lactation we have got, wherein the author discusses about the various different conditions in pregnancy, or like like abortion, if any abortions in particular month, okay, or tendency for abortions, etc. Okay, then lactational complaints that the author discusses in pregnancy, parturition, and lactation chapter. Or even heart circulation, wherein various heart conditions with like maybe functional conditions or pathological conditions the author has listed. And also the circulatory complaints related to the circulation, if person has got any issues, so that is discussed in heart and circulation. So these few chapters are very important, like which we don't find very commonly in the other sections. Yeah, so these are the few things which we need to highlight in Knerr Repertory. Okay, so if we refer it more frequently, maybe like we can get a very good guidance regarding things. And as I told you, there are the remedies. If you see the remedy, this rubrics, you get only one or two remedies in front of this. So there is no much big list of remedies, okay, wherein you need to differentiate and all. One or two remedy differentiation is much easier. Like you can see here, face with deep furrows, only one remedy lycopodium is there. So if a person has that and if other symptoms match, then lycopodium can be directly thought of. So the beauty of these concordance repertories is that they have got very small number, very few, like you can count them. One, maybe sometimes one remedy or maximum 3-4 remedies will be there. So differentiation is not difficult like compared to other classical repertories. So these repertories can be used as a effective reference books. We cannot do classical repertorization like how we do in Kent repertory and all. And one more thing is the for beginners, these repertories are very useful because the language is very easy. Whatever the patient says, you can directly go and search them here in the repertory. You need not convert them like how in Kent we need to convert it into the philosophy. We will not get the direct patient symptoms, so we need to convert it and understand. So that one difficulty we do not find in this. If patient says one symptom, you can directly go and search in the repertory. So directly we get entire patient symptom and related remedies are given. So the language is very easier for the beginners, for students and all. So as a student, when you start practice, you can use these repertories. Okay, and always like repertory is said to be very difficult because whenever we discuss the mind section of like other repertories, so it is very difficult to understand the rubrics related to the mind, the interpretation, how the patient says or what the patient does, to convert them into rubrics and to find the remedies. They find it very difficult. But here, when you come to this concordance repertory or this Knerr repertory, that difficulty you will not have directly. Like patient, what the patient is doing, you will get them in the rubric form. Okay, and the related remedies are also given. and the selection of the remedy is much easier. And even like if you have some pathological conditions, you can directly refer them in relation to that symptoms as is shown you. There is like in the bracket they give physiological or pathological condition related to the symptoms. So directly you can refer that symptom in that particular section with that pathology you can go. But author also says that this, for example, now in this face gray, especially nose color of bleached coal ashes in chronic asthma. The author says that when we give this pathology, we should not restrict that this only in this pathology we find this. Maybe like if symptoms match in even other pathologies, these symptoms we can match it and give the remedy. So we should not, the author is very open-minded and he gives us the advice that we should not be closed because it is given in the repertory. We should not say that okay, only we find in this particular pathological condition this physiological association. It is not like that. Maybe some other pathological condition, this physiological association may be there. So we should be open to it, and if it fits, then there is no harm in using these pathological conditions for the reference of the remedies. So these are the few important sections which like all of you can refer and study more, and maybe it may be useful like how it is helping me. So maybe in the same way it can help you all also. Hello, ma'am. Hello.
Yes, ma'am.
Yes.
Yes, ma'am.
Yes.
Thank you, ma'am. Thank you so much for the enlightening session. So, respected participants, if you have any question, kindly comment in the comment box. So, madam will be answering it. Yeah. Ma'am, there is a question from the participant.
Yes, ma'am. How to repertorize using this repertory? Actually,
Yes, ma'am.
manually when we are going, as I said, the remedy number is very limited. So repertorization not needed. You can just write down the symptoms of your patient and then just write down the remedies in front of that and just see what is the common remedies there, whether the common remedies are there in all the rubrics. And now as this repertory is available in HomePath series, okay, so you can, if you are familiar with the HomePath repertories, you can directly get the repertorization chart as such. Manually you have to write down the symptoms, note down the remedies, and then see which are the common remedies running in the rubrics. That is how you can do this. We cannot do the eliminating method like how we do in Kent and all, but we can just write down and check for it.
So, any other question from the participants? They can put it in the comment box. Yeah. I have a question, ma'am. Whether this repertory can be used in chronic cases also, ma'am?
Yes, ma'am. It can be used. The rubrics are there, and see, ultimately in homeopathy what we do is the symptom similarity. So whether it is chronic or acute conditions, we have to rely on the symptoms, and these symptoms are listed in the repertory, and very much in chronic conditions we can use this repertory.
Yes, ma'am. Thank you so much, ma'am. I hope there is a question from the participant, ma'am.
Yes.
They're asking you to.
Okay. So one case we had seen long back, wherein the patient had one particular symptom, that very severe headache the patient had, and he had like that this condition was very much relieved by pulling the hair. Literally, the patient used to pull the hair, and he used to feel better with that headache. And we searched many repertories and we could not get. and we got it in this repertory. I don't remember the remedy name now, but that we had searched here. And one more case wherein patient had a constipation. The constipation, that patient told that like whenever the stool falls, it like like a stone. The sound comes like a stone. So that one we had referred in this repertory, the symptom for the patient, and with the other symptom matching, we had prescribed. As such, repertorization we had not done, but for reference we had used in these two cases. In many cases, like still I make use of this, like when we don't get the symptoms in other repertories. So I do use this repertory. This repertory we will get usually most of the symptoms which are not there in other repertories.
Yes, ma'am. Thank you so much, ma'am. And any other question from the participant? I hope in this repertory, the major pros are like we can directly have the symptoms which has been described by the patient. If I am not wrong, right, ma'am?
Yes, ma'am. Yes, ma'am. That is
Yes,
why
yes.
we call them as a Puritan repertories, where the purity of provers or the sick patient's language is maintained as it is, without much of the alterations.
Yes, ma'am. Yes, yes, ma'am. So I hope they all have cleared their questions also, ma'am. I think. So if the participants have any question, they can kindly comment in the comment box. As for the last time, yeah.
Actually, this is very vast repertory and it cannot be covered in 1 hour. I've tried, but I don't know how much I'm successful. But this is a very vast, and 1 hour or one day we cannot read it. To refer it, we need to keep constantly reading and referring. Then we can understand much better. And the self study is much better than like we can understand much depth.
Definitely, ma'am.
Mm.
So I hope it's a wrapping time, ma'am. I think they are clear with the question. We'll have one more session, ma'am, which will be hoping for the another one more session. And thank you, ma'am. Thank you so much for enlightening us with the new, different perspective of Knerr Repertory and its very the uniqueness and the unique matters pertaining to it. And thank you all the participants also. And ma'am, we look many more from your side, and we'll be looking forward to learn more like this. Yes, ma'am.
Thank you so much.
Thank
Thank
you,
you.
ma'am. Thank
Thank
you,
you.
all the participants. Yeah, we'll be back with another session by tomorrow. Yeah, by on Monday. Thank you so much. So, thank you all. Thank you, ma'am.
Thank you. Good night.
Good night, ma'am. Yeah, ma'am.